Factors affecting drug absorption. So how are drugs delivered to the body? This can be classified in multiple ways, one being just where they are delivered. So the face, whether this is the eyes, by the nose, by the ear, by the lungs for inhalational routes, by the GI tract, so oral, sublingual or rectal, intravenously, in and around nerves, so epidurally, intrathecally, perineurally, and by the skin, so subcut, transdermal, intramuscular. Drug absorption is the movement of the drug into the bloodstream after administration. This can be affected by the drug itself, but also patient factors. The drug factors relate to the formulation of the drug, but also the physiochemical properties, which is just a complicated way of saying how the chemical structure of the drug affects how the action of the drug is achieved in a given patient. So if you first look at the drug factors, this relates to the formulation, the form of the drug. So is it a solution? Is it a tablet? Is it a suspension? The ingredients, these relate to active and inactive ingredients. Active ingredients relate to the chemical substance of the drug and how that exerts its physiological effect. The inactive ingredients include things like lubricants, binders, vehicles and colorants. The dose. So generally a larger dose produces a faster onset of action. However, this is dictated by clinical trials. Lipid solubility, so how easily does that molecule cross a lipid bilayer? So the more lipid soluble an agent is, that's more advantageous. Ionization. This relates to whether a substance is an acid or base, the local pH where that drug is given, but also the pK. So for a given pH, how much of that drug is ionized and unionized. Remember, the unionized portion is the active portion which can cross lipid bilayers. And also the size. So generally a larger molecule has a slow onset of action. So patient factors, this relates to health, so local blood flow. So the greater the local blood flow, the greater the uptake of agents. And this is especially important for lipid-soluble agents. Organ function, so for example, stress, alcohol, food intake can result in altered GI motility, gastric emptying, and altered gastric pH, which can affect the degree of ionization and uptake of the molecule. Membrane physiology, so how is the drug absorbed? Is it by active diffusion, passive, or facilitated diffusion, or endocytosis? Also aging, so as patients age, this can result in delayed gastric emptying, for example, and obviously reduced absorption of that agent. Disease states, so disease can affect every organ in the body. For example, liver disease can result in alterations in first pass metabolism. Cardiovascular disease, heart failure, for example, can result in bowel edema and altered splanchnic blood flow, which can result in altered absorption of agents. But also multi-system disease, for example, Parkinson's disease can result in delayed gastric emptying. Drug interactions, so meprazole reduces absorption of ketoconazole, but also receptor polymorphisms can have an effect.